Hi, my name's Elisa Rozier. I'm a pediatrician in Alaska. Today I'm going to talk about a project that I'm working on about virtual peer support in Alaska. So just a bit of background about myself. Grew up in Michigan, and in high school, I had an experience where someone close to me asked for help in a meaningful way by starting to go to 12-step programs. And historically in my family, like everyone had to be perfect. There's a lot of perfectionism, a lot of academic success. And that person asking for help in a real way really left an impression on me that it's okay to ask for help. Now, that being said, even though I had that experience, I still didn't adopt it as a personal philosophy until much later in my life. But it was nice to have someone close to me ask for that help. So fast forward, college, medical school, residency. While I didn't have any problems with like drugs or alcohol, I did use food as a drug. So for example, in college, study really hard for a test, study, focus on the test, go to the test, and then afterwards, as a reward, I would binge eat a lot of junk food. And that cycle, as with any addiction, it's a progressive disease. And so it got worse and worse and worse. Now in high school, in college, and medical school and residency, I was running around a lot, never showed up on my body, but there was that compulsion to eat compulsively after stressful events. And so I knew that I had an issue, but philosophically, I thought, okay, I'm a doctor. I know everything about nutrition. Well, not everything about nutrition, but I know a lot about nutrition. So I can figure it out myself. I don't need to ask for any help. So after pediatric residency ended, 2009, I came up to Alaska and took a really stressful job at the hospital. And for the next nine years, worked at the hospital. There are no subspecialists in Alaska. Well, where I was in Alaska, no pediatric subspecialists. So really, really fun job, but very stressful. And that cycle continued. And another aspect of where I was in Alaska, a very small town. And so there was an Overeaters Anonymous meeting that I knew about, and I knew that I should go there. But, it's a small town. The meeting is announced over the radio every day on the radio. It's a Saturday at 10 a.m. at the specific building. Another thing about being in a small town, everyone knows, because we drive so slow, everyone knows what kind of car you drive, and they can see you. So to me, that was just a no-go. I couldn't go to this meeting because everyone would know I'd have a problem. So in 2014, I was driving down a lonesome road in rural Alaska. I was listening to a CD that was given to me about recovery. And I just had this epiphany. I was like, Elisa, you're a doctor, you know better, but it's still okay to ask for help. And so I allowed myself mentally to ask for help. That was on a Tuesday. And then on a Saturday, I went to my first 12-step program. And my current sponsor was the person who led that meeting in May of 2014. And in the preamble of the meeting, she said, you never have to be alone again. Like, there is support for you if you want it. And that was very, very reassuring to me as someone who had never asked for help in a real way. And so fast forward 2018, I transitioned from the stressful hospital job to private practice, and my hours got better. I was working outpatient exclusively. And then COVID hit, and so transitioned again to telehealth with in-person visits as needed. And one of the really positive things of COVID for me personally, in terms of support, is I started going to meetings with a group called IDAA, which is International Doctors AA, and it's exclusively for licensed healthcare professionals who are in recovery for any substance. I'm the only person who goes with food addiction. Most people have like other drug addiction or alcohol addiction, but very supportive daily confidential Zoom meetings. And that was integral in my getting through the pandemic. Very, very supportive. So still doing pediatric private practice. And in October of 2022, so just about 6 months ago, I found myself in a peer support training. And I didn't really know what peer support was, and I'm not sure how I got signed up for the training, but it was a wonderful training. And basically, as a pediatrician, the medical model, I know it works. And I was in the peer support training, and during the introduction, they said basically health insurances know that the peer support model also works and they cover it. And I never knew that. And I know as someone in long-term recovery that the peer support training model does work and the medical model does as well. So sitting in the training and basically like a marriage of two very important aspects of my life occurred. And from that training, there are a lot of local stakeholders at the training. We don't locally have any peer support specialists who are helping the community. So from that training, we started a collaborative effort, and we've been meeting on a very regular basis since, trying to explore how we can implement peer support in our local area. Now, we're very isolated here, and we don't have a lot of mental health resources. So one of the nice things about peer support is that it kind of could potentially provide a bridge while families are waiting for mental health resources to become available. There are extremely long wait lists here, or substance use resources to become available. At least having a warm handoff with a peer support specialist, someone who is available on a daily basis in a very practical way to help the client with whatever they need help with that day, in order to improve their mental health or in order to improve their substance use. So it's a very positive, hope-filled process, and we are working hard here in rural frontier Alaska to figure out how we can stand up peer support trainings. As far as my goal for the future for this, I believe really strongly in providing peer support virtually. Alaska is a very spread out state, a very small population in a very spread out area. We are the largest state and we have one of the smallest populations, but so, lots of different, very, very tiny villages across the state. And I believe that the anonymity provided by virtual peer support is really important in those very rural small towns. And this is a service that is provided down in the lower 48. And it's my goal in the next 5 years to get a program together where any Alaskan could access virtual peer support. And so that's what I'm working on up here, what we're working on. And thank you for allowing me to share.